I'm out speaking at an event, but I did want to get one of these done, and I want to clear up probably one of the larger misunderstandings in American healthcare. When people hear that a hospital is either for profit or non-profit, they automatically have these assumptions, right? They assume that if it's not for profit, that means that hospital has no profit, there's no surplus or running in the black, and there's no financial gain whatsoever. That's not actually what not-for-profit means. And I think we need to understand what it really means so that we can better address when we hear people say, well, this hospital's not for profit, I want to go there. A lot of healthcare behaviors suddenly will make a lot more sense when we understand what nonprofit means, because it doesn't mean that the organization can't generate revenue above expenses, because it does, number one, if it wants to be sustainable, but it absolutely can. Remember, hospitals are still billing insurance providers. They're still collecting payments from members, negotiating contracts for MA and ACA and group plans, and they generate operating margins so that they can be sustainable. The difference is not whether they make money or not. The difference for a nonprofit hospital or setting is what happens to the money once they bring it in. So a nonprofit hospital doesn't distribute the profits to shareholders like you're going to find in a for-profit company, right? And let's go ahead and get down to the basics of not-for-profit and for-profit are not evil just by name. The surplus that they have must be reinvested back into their facilities, their staffing, the technology they use, whether they're expanding or not, and different programs that they fulfill in the community. So nonprofit status then is about who the ownership of the actual structure is. It's not about whether the hospital or entity performs financially. And even as nonprofits, the hospitals still have to operate inside a very real economic system. They still manage their payer contracts. They still look to optimize reimbursement from payers or plans, expanding services and acquiring new physician groups, and they do compete against other nonprofit hospital organizations and for-profit hospital organizations, because if they can't maintain their financial stability, then they cease to exist. They can't even operate at all at that point. Now, healthcare ultimately should be mission driven, but it's still capital intensive, right? You still have to survive. You've got buildings that you need paid for, and equipment to build those buildings, and staff in those buildings, and keeping up with compliance and technology. Hospitals require, quite literally, enormous financial resources to run. So financial strategy then for a nonprofit hospital isn't like some optional thing where they can run in the red for the rest of their life. They have to survive. Now, another myth that people assume about the not-for-profit structure is that if a hospital is not-for-profit, well, their prices must be lower than our local government-run hospital or our local for-profit entity. And that's not necessarily true. Hospital pricing is influenced by several factors. So the regional contract negotiations that they have with insurance carriers, the payer mix, or where they're getting their funding from, the demand for their services, the amount of cost their facilities bring, and if they're getting any federal reimbursement. So maybe they're bringing Medicare Part A and they're getting DRG reimbursement, right? Not-for-profit status doesn't automatically reduce your pricing, because pricing in the U.S. healthcare isn't based on your organization's tax status. It's based on negotiated reimbursement structures amongst your group. So you could have two hospitals in the same city. You've got one for profit and then one that's not for profit, and they can charge extremely similar amounts for the same exact CPT or HCPCS codes. But the system is determining the price. It's not their tax classification that's determining what they're paying for these things. The real policy logic then behind nonprofit hospitals, at least in exchange for that kind of tax exempt status that they receive, is that these hospitals are expected to provide benefits to their community. So that can include things like charity care, or community health programs, or exclusive trainings to your local communities or public health services. The theory behind a not-for-profit hospital is that this group will reinvest its surplus back into its community, and its community will be better for having it there. if with that being the case, then the tax exemption in the government's mind is justified on why they're allowing it. Now, whether every non-for-profit system fulfills that expectation equally, it's not up for debate right now, though I'm sure they don't. And people often publicly complain and debate about things like this. But structurally, that's the framework of how a not-for-profit hospital or organization operates. So I think the important thing for us to understand then is that not-for-profit hospitals, they're not charities that do everything for free. They wouldn't be able to exist. However, they are large healthcare organizations that are operating under a not-for-profit or nonprofit ownership model. So they still generate revenue. They still manage their own expenses. They pursue expansion, and they make financial decisions that are strategic for them so that they can continue operating. Remember, the difference is simply that the surplus inside of a nonprofit hospital is used to fund goals, right? To fund the community and to grow staff. It's not just used for shareholders. In healthcare, nonprofit doesn't mean that there's no money. It means that there's no shareholders that they're answering to. Once you get a picture of that, then a lot of hospital behavior suddenly stops looking so mysterious and actually starts making a little bit more sense.